Health status outcome with invasive or conservative care in coronary disease. Definition: coronary heart disease, also known as coronary artery disease, is a condition which plaque is deposited inside the coronary arteries. These arteries supply oxygen-rich blood to the heart muscle within the heart muscle.
The question we asked for the ischemia CKD trial is in patients who have advanced CKD and moderate, at least moderate ischemia on stress test, is there a benefit of adding cardiac catheterization and revascularization if suitable to optimal medical therapy? To this end, we designed an international randomized controlled trial. This was funded by NHLBI. The design was to enroll patients with moderate or severe ischemia and advanced chronic kidney disease. Patients were randomized 1-to-1 either to an invasive strategy of optimal medical therapy and cardiac catheterization and revascularization, if feasible, or to a conservative strategy of optimal medical therapy alone with cath and revascularization preserved for failure of optimal medical therapy. The primary endpoint was a composite of death or myocardial infarction. Our major secondary endpoint was a composite. It was a 5-point composite. It was a composite of all-cause mortality, myocardial infarction, hospitalization for unstable angina, heart failure, or resuscitated cardiac arrest.
Application in nursing. Monitor vital signs. Observe for listening and events that improve or affect the patient conditions. Medicine administration. Educate the patient about the adverse effect of the treatment. Monitor cardiovascular status.
Hi everyone, I'm Pranothi Hiremath. I'm here after the late-breaking trial of ischemia with Dr. Roxana Mehran. Dr. Mehran, we are here to ask you what your main impressions of the trial are, how it will impact your clinical practice, and also what you see for the future in terms of trial follow-up.
Well, first of all, thank you for having me, and I love Fits on the Go, so thank you for that. Today was a historic day. I think we finally got to see the results of the ischemia trial, long awaited, over 4,000 patients randomized with stable ischemic heart disease, moderate ischemia, and somewhat angina, not a lot of angina, but somewhat, not refractory angina, but stable ischemic heart disease. And there we found no difference in the primary endpoint of cardiovascular death, MI, heart failure, unstable angina, and cardiac arrest, out of hospital cardiac arrest. And no difference in death and MI. There was an important divergence of the curves that I think is very, very important to note, especially given that it was myocardial infarction reduction, spontaneous myocardial infarction.
Pros and cons. Pros. The disease can be prevented and controlled through changes to a heart, healthy lifestyle, and medications. Cons. It can lead to chest pain, angina, or a heart attack. It can weaken the heart muscle and contribute to the presence of heart failure and arrhythmia. Heart attack.
When a myocardial infarction strikes, the blood supply to the cardiac muscles is suddenly restricted. Starved for oxygen, these muscles begin to die, and within minutes are unable to keep the heart beating. The cause of this life-threatening attack is the obstruction of a coronary artery by a blood clot, resulting in most cases from atherosclerosis, which in the coronary artery is called coronary artery disease or CAD. In patients with CAD, atherosclerosis can begin to develop decades before symptoms arise. Since atherosclerotic plaques grow slowly. When a plaque ruptures and a blood clot forms, the threat of a vascular event becomes very real. Clots consist of activated platelets stabilized by fibrin.
According to the latest published WHO data from 2017, deaths caused by coronary heart disease in Ecuador have reached 8,341, 12%. Of all deaths, the mortality rate by age is 60 per 1,000 population. Ecuador occupies the 169th place in the world.
So coronary artery disease may not manifest any symptoms. Some patients have no chest pain at all, but on exercise tests or some form of stress testing, there is evidence of lack of oxygen supply to the heart. Another group of patients present with what is called a stable angina, where on exertion, for example, when the person walks very fast, or when he runs, when he climbs stairs, he experiences chest pain, chest discomfort, tightness, or breathing difficulty. We call this a stable angina. The pain
Conclusion: heart disease is the leading cause of death in the world. It is also a major cause of disability. It must be taken into account. They can be prevented this type of disease by knowing the risk factors. Learning about them can lower the risk of having heart disease.
My insurance required to know my numbers, which means to go have your lipid panel done, which I did. And my total cholesterol was a little over 200. And then my LDLs, which is the unhealthy cholesterol, was over 100. Looking at my panel, I just took it to one of the cardiologists that I work with, and I said, hey, what do you think about this panel? And he looked at it and he said, well, is this yours? And I said, yes. And he said, well, it's not ideal, but you're young, you exercise, you eat healthy. Go have a calcium score done and see what that is. My calcium score came back, a total calcium score was 14, which doesn't sound terrible, but it was scary. It wasn't right. They wanted more information, which led me to see Dr. Sharma, and they ordered what they call a CT angiogram of the heart. It did show that I do